Please join us every week for a new episode of Understanding the Human Condition with Dr. James Flowers. Dr. Flowers and his most admired mentors, respected colleagues, and VIP guests will share valuable insight into underlying health causes, conditions, and issues. These in-depth yet approachable episodes are a great resource for both private individuals and industry professionals. Our esteemed host, Dr. James Flowers, is one of the most recognized and respected names in the field of chronic pain, mental health, and substance use disorders, both nationally and internationally. Dr. Flowers is the founder of J. Flowers Health Institute, located in Houston, Texas. For more information about J. Flowers Health Institute and its concierge services, go to jflowershealth.com or dial 713-783-6655. And be sure to mention this podcast.
Welcome to Understanding the Human Condition with your host, Dr. James Flowers.
Hey, Robin.
Hey, you.
How are you?
I'm good. How are you?
I'm good. I'm so excited that we have Dr. Davis here today.
I know. Welcome.
Hi, how are you?
Well, good. We really wanted to talk to you a little bit. I mean, first off, before I read your bio, there's a lot of women out there, I think, that I want them to tune in and have their friends tune in, because you're really going to address some issues that a lot of women are dealing with right now, female issues and thyroid issues and diabetes and a lot of these things. So please tune in and share this with your girlfriends. But if I can humor all of you with the a quick bio here, and then we'll get into some good conversation. Dr. Anu Davis practices medicine with the River Oaks Doctors Group. River Oaks Doctors Group is an internal medicine and endocrinology practice servicing patients in Houston, Texas. Dr. Davis' medical interests include general endocrinology, diabetes management, thyroid dysfunction, nodular thyroid disease, thyroid cancer, polycystic ovary syndrome, and endocrine dysfunction in pregnancy. She is married and has 2 children. Welcome.
And I think you cut her bio by about 75%
We did.
because there's so much more to you.
We did. But we only have a limited amount of time.
I know.
Yeah.
So is there anything about you that she didn't mention that you'd love for everybody to know?
I've been in Houston my whole life, and I don't think we're leaving.
Yeah.
So, and that's part of kind of our practice and the way we practice medicine. It really comes from both me and my partners, that we've all been here forever.
I love that. Same. Were you born in Houston?
No.
No, me either. But I came to Houston when I was the summer of my 8th grade year. So I went to high school here. And that's the way our practice is. It's the same. We feel like we're just rooted in Houston, and the therapists that work here have all been here a long, long time.
Well, I mean, I've been here since I was 4, and I trained here, right? So and I trained both at UT and at Baylor. So when you do that, by the time you finish, you've met a lot of people.
Absolutely,
right?
yeah.
So,
you're rooted in Houston. Absolutely. I know that you have an amazing concierge practice right here in the River Oaks area. It's personalized care, similar to what we do, but of course on the medical side. Tell everybody that's listening about concierge medicine and what's the difference between concierge medicine and a practice really and a traditional medical practice.
The main difference is the idea that you actually have access to your physician. And there's lots of different models of concierge practices, but the main issue is that, because of the way insurance companies contract with physicians, a lot of times patients are having to change doctors every couple of years, and that continuity goes away. Yeah. So, that's why I said at first, none of us are ever leaving.
Right.
We're here, and we're staying, and we're sitting in that office, and we're always accessible by phone or email or text or anything.
Yeah, absolutely. That's nice. Same, I have a concierge physician as well, and it's nice just to have a cell phone that you can text and ask a quick question to, and they limit the size of their practice, which I'm sure you do as well.
In some ways, yeah.
And in some ways, and it's nice to be able to have that relationship and not have to depend on insurance, changing insurance at the end of the year, saying, well, that doctor is now out of the network or what have you. So
correct. And so the main thing is when you went to medical school, you went to take care of patients. Right. And when you get out in the world, sometimes that patient care gets disrupted by all the other rules. So we kind of took away some of the other rules.
Yeah, absolutely. And you have a little bit of a nuance on concierge medicine just because of the location that you're in Houston, right? You're right here in the River Oaks area, right down the street from us at J. Flowers Health Institute off of San Felipe and Kirby. What are some of the nuances? A lot of times we'll work with psychologists and psychiatrists, and we've had a lot of psychiatrists and psychologists on the podcast that work with high net worth individuals. And quite frankly, that's your population, most of your population, and it's what our population. What do you think the difference is? I know that you treat people the same regardless of income or race or anything else, but when you have a high-end concierge practice, there's nuances to that. And so talk a little bit about that.
I think the main issues that come up are that time is a big deal, right? Time is money, and people need their time respected.
Right.
And one of the things about general medicine practices is that that's not even a part of that. So in our practice, that's a priority. Time and privacy.
Yeah.
Those are the biggest things to get people moving through the system as quickly as possible.
Absolutely.
Right.
Yeah, so they can just get back into their life and get going.
Right. And understanding that they're going to be doing their whole life while you're doing
Exactly. Yeah, exactly.
Actually getting them to stop is a challenge,
Yeah.
right? They need to do everything, and their privacy needs to be maintained, and
Yeah.
they need to be functioning in their
Absolutely.
world. And so the goal is always to get people back.
Yeah, and speaking of privacy, one of the things I think that you do for privacy is you actually make a lot of house calls. You go to people's homes every day, right?
We do. We make house calls, and all the physicians in our practice make house calls. We do home management for when people are discharged from the hospital, just for that couple of weeks or that transition time. A lot of times we discharge people from the hospital, and we don't have. I mean, the instruction is poor, right?
Right.
Of how to manage the pain, or how to is a pill bottle really going to tell you how to manage those things,
Right.
and how to. So we will go visit people in their houses.
Yeah.
And the other thing about seeing
That's
people in their
huge.
houses is that you really get a sense of what their support system is and help them access their support system.
That's very cool. Yeah, you guys are. I was talking to my niece last night about you coming on the show, and she goes, "What a small world." The other Dr. Davis in your practice works with my niece's father-in-law, and she said it's just changed their lives because they're all busy and they all work, and the children work, and he just moved. In fact, Dr. Davis helped him move from his home into an assisted living type independent living home, and is having some medical issues. But they said the service that you guys provide to their family has just been invaluable. So
Well, one of the things about that is just having people who know how this works, right? You don't have to reinvent the wheel every single time someone has to move from their home to it.
Yeah.
But you do have to have an understanding of how that stuff is paid for, and where the different options are for paying for it and addressing it, and how quickly things can move. And some assisted living facilities will have medical floors, and
Sure.
you need to have some expectation of what the patient's going to need, and be able to anticipate that so that you can help them make better choices.
Yeah.
And so we have a case manager who works with us who really she's been in Houston for longer than all of us, and
Sure.
and she can help navigate
That's
our
great.
patients through a lot of that.
That's amazing. How did you go from practicing? You have a long career. How did you go from practicing in a general type medical way into a concierge type practice?
For me, it was totally by accident.
Was it? Yeah.
I was faculty at the medical school,
Yeah.
and I was hanging around working on a big quality project for Memorial Hermann System.
Yeah.
And I met my partner's wife, working on a big project.
Sure.
And she was like, "Oh, well, you should meet my husband." And it was the way he practices medicine and the way that they were doing it, and they were just at the beginning of kind of branching out. And so endocrinology is a good specialty to add to internal medicine, because Jay and Amy, my two partners, are both general internists. But endocrinology, it has little niches, but there's a lot of general medicine.
Right.
So it's a easy thing to both be narrow in and also be broad in.
Absolutely. Speaking of endocrinology, just a little statistic that more than 34 million Americans have diabetes, which is about 11% of the U.S. population. That's huge.
Yeah.
That is huge. Do you see that a lot in your practice?
So most endocrinology practices are about 80% diabetes.
Oh, wow.
Mine is probably closer to 40 to 50% diabetes, but still quite a lot of diabetes, a lot of pre-diabetes, and diabetes changed a lot. The management of it and the prevention of the complications has changed a lot in the last decade.
Right. Absolutely.
And so it's a fun thing to do. And it's one of the places where it's very comprehensive, right?
Yeah.
You need
Sure.
dietitians, and you need educators, and you need people who understand the new technology.
Yep, that's
So
right.
we do all of it all at once.
Nice. Robin, I think you were going to say something and I cut you off.
No, not at all. No, I was just, what is the age range of your patients from like the youngest to the oldest?
I probably see patients as young as 16.
Oh.
And well into their 80s and 90s. It runs the gamut.
So you're probably into the second generation of families, and you're getting
absolutely.
into.
We take care of whole families,
Yeah.
top to bottom. Yeah.
That's really cool.
It's pretty fun. Yeah.
And then the diabetes. As far as diabetes, what do you think the main cause? I mean, what is the biggest issue that is it just something that they're passing on from generation to generation, or is it
history
poor
and
food?
lifestyle, right?
Lifestyle.
Lifestyle is a big issue when it comes to diabetes.
People
And,
just aren't.
people are
taking care
getting
of
better, but
themselves.
we want to be better, but
Yeah.
we still run very busy lives.
Mm-hmm.
And
fast food is just
And
fast.
the food that we eat and desserts that we eat and
Yeah.
So people are trying and want to be better, but lifestyle management is a huge thing. So one of the things have really always been interested in is polycystic ovary syndrome, which is, it's the number one cause of infertility, and it's kind of a pre-diabetic state. So it's a place where you have a lot of opportunity for intervention and a lot of opportunity to work on the prevention side of diabetes. And so, and it's a really, it's a population, because if women are trying to get pregnant and working on infertility, they're motivated. And so it's a great place to work on prevention. And so one of the things I like most, and why my practice is a little bit less diabetes and a little bit more other endocrine, is because I do a lot of prevention in polycystic ovary syndrome.
yeah.
Gotcha.
And so that's where I kind of run into young girls and like high school and college age students is in that. And I mean, post-college too, but that's how I get some of the younger.
And catching it before the infertility issues start.
Catching it earlier before infertility issues become a problem.
And what are some of those symptoms that send them
Symptoms
to
of
you?
polycystic ovary syndrome are acne, excess hair growth where you don't want it, irregular menstrual cycles, weight gain, especially, when you see weight gain in young adolescents, like that's outside of what their family would, what they don't look like their family. That's kind of when you start to think about those things. So irregular menstrual cycles, weight gain, and then we look at blood work, so abnormal sugars, we start to see that early.
Gotcha.
How did COVID affect your practice last year?
Oh, yeah.
Both really you and your family, how did it affect you guys? But more importantly, or equally important, how did it affect your practice? Because you go into people's homes every day.
Yeah.
We're very grateful in my family that we've been kind of safe from the COVID, but practice just changed, right? So, and our patients use the phone a lot more.
Yeah.
So for a few months, it was just about phone access, educating people, one patient at a time. As much as you can educate, people were hearing the news. There was so much information coming their way, but it was like, how do I get my kids back from college? How do I get, how do we traverse all this?
Should we do it?
Should we not? Manage managing the COVID that came up. We had lots of people that got sick, and thankfully most of them did very well, right?
Yeah.
But the practice changed just from a phone. We probably did a lot more phone and telemedicine. We were set up to do the phone and telemedicine even before that.
Right.
So it wasn't it was just kind of a shift for us. But definitely, we've chatted with a lot of people this last year.
Yeah, exactly.
And then we
Likewise.
we were able to send someone to people's houses to get tested and things like that, which
Good.
Adds convenience.
Yeah,
so you
absolutely.
weren't standing in lines in the CR and that kind of stuff.
Yeah. Did you see an increase in your patient population, really across the population, mental health, depression, anxiety increase last year?
Definitely.
Yeah.
Right. The anxiety, and I think even in the last 6 months, I've seen a lot of baseline anxiety.
Yeah.
People who already had diagnosis of anxiety, you could watch it,
Yeah.
and then even people who had never had any,
Mm-hmm.
it showed up.
Yeah. And because you guys get to spend so much time with your patients, like we do in a more of a concierge practice, it's not rushed and you don't see 50 or 60 patients a day. You get to see the number that you need to see or that you want to see in a day. And you really develop a therapeutic alliance and a medical relationship with your patient.
Sure.
And so when you see little things pop up, like maybe, is he drinking a little more, right? Or is she drinking a little more? She called in early for a refill or something like that, kind of what's going on. How do you handle situations when you notice something just a little askew?
Well, I mean, one thing about it is that we have a lot of communication with our patients, right? So, and they'll tell us, and it's kind of nice when that relationship's already established.
Yeah.
Then we're the point of care, right? So they actually will tell us when they feel like things are going the wrong direction.
Yeah.
And we still pick up the phone and talk to other doctors. So we talk to people's therapists and we talk to people's psychiatrists if we know they're struggling or we know that they're in a situation where they're going to struggle. Like it's not like 5 doctors sitting in different offices, right?
Yeah.
We try to make a team for the patient in some way.
Absolutely. Good.
And you treat a lot of patients with chronic illness.
I do.
Yeah. You want to tell the audience about that?
So diabetes, of course, is chronic with multiple complications and multiple, we have patients who have kidney disease and patients who have circulation issues because of the diabetes, and can be debilitating over time. And we try really hard to anticipate. Each patient's different, so what they're going to have trouble with is based on them. And if we're able to anticipate a little bit more and help them kind of have a sense of where things are going and what the kind of timelines are in front of them, they're able to prepare for that. And I mean, that's a big thing. And getting help and building their support system as the diseases become more debilitating. I see a lot of thyroid disease, which sometimes comes along, like with other inflammatory processes and autoimmune stuff. So, although I'm not the rheumatologist, I end up managing a little bit that and working very closely with rheumatologists.
Yeah.
Gotcha. Yeah. What do you do to take care of? What's your self-care? I mean, you're so busy taking care of everybody else. What do you do to take care of you?
I am a really good sleeper.
Are you?
I am, and I do a lot of yoga.
Okay.
And those are my main. And if I'm going to yoga and I'm sleeping and I'm reading books, then that's my little triangle.
Good.
And I do really well with that.
Do you?
And if one of those things falls off,
It all starts to fall off.
It all starts to fall off. But, I think it took a lot of time to figure out that's my minimum, and I have to do my minimum to do all the other things.
In fact, you encouraged me to go to your yoga studio over off of Waugh and Allen Parkway, and I haven't gone yet, but I'm a retired marathon runner, and I picked up swimming recently.
Okay.
It is a whole different ballgame. Oh, my God. I was like, I've run marathons. I've done 28 marathons. I run 100-mile races. That cardio is going to be easy. It is so different.
What do you do in the lap pool at the Houstonian?
Yeah.
Are you?
Swimming is just
That is hilarious.
It is hysterical. I swam 2 links, I guess, which is 1 lap. And I was like,
Well, so on the flip side of that, I grew up swimming, and my daughter's a swimmer.
Oh, yeah?
And when we went to run the loop at Rice one day, and she's like, "What is your problem?
Yeah.
This is so easy."
I know, right? Come on, Mom. I can do that. I know. Adam over here is a yogi too, right? I need to go to, what's the studio?
Big Power Yoga.
I need to get in there. I've got to get in there. I'm
Big
still going to
Power
keep
Yoga.
swimming and get my cardio, heart rate down and cardio up. But Yeah, swimming's my new thing right now.
Those are the things I do. What do you do?
Yeah, what do you do?
Well, I used to get up and run 6 or 8 miles, and now I'll walk 4 or 5 miles. I love to work out early. I'm an early morning person, so I'll get up and go to the gym and do my workout. And this morning I went to the gym and did swimming from 6 to 7, and then worked out from 7 to 8. And that
Nice.
it is amazing.
It changes.
Walking out of there, how much better I feel.
Yeah.
When my alarm went off at 5 a.m.,
Oh,
I was
you're
like, do I really want to go swimming today? And I was like, yes, get up and go. And you do it, right? And you get in the water and it feels refreshing, and then you start swimming, and I'm trying to work on my rhythm and learning how to bring my head out of the water. There's a lot of things to remember in swimming, number one.
Do you have a swim coach? Do they have a swim coach there?
No. I'm a typical male. I'm going to do it on my own for a while. I'm going to try it on my own. But
that's hilarious.
And so I'm getting better, right? I'm getting a little bit better. So I swim, and I do a Zen class. Typically, if I'm home by 5:30, I'll do a Zen class with the Houston Zen Center, like from 5:30 to 6.
Oh, nice.
And then on Sunday mornings, I'll do another Zen from like 8:50 to 10 o'clock, which is nice.
That's
and,
good.
Yeah, so
you
meditation.
Need that.
Yeah.
Have you done meditation at the cisterns?
No, friends of mine went on Easter Sunday though.
It's pretty cool.
I've never been to the Sister. Have you been?
No.
It's off of Allen Parkway, isn't it? Tell us
Buffalo.
about that.
Yeah.
'Cause I want to go.
Tell us.
I mean, they do meditations with
Yeah.
the meditation bells,
Yeah.
and and it
Yeah.
echoes in the cisterns.
Yeah.
It's kind of great.
It's supposedly just amazing. So we should go do that.
we should.
Yeah.
That would
I
be
think
fun.
they do it every weekend.
Do
I
they?
mean,
Yeah.
like a patient told me about it.
Right.
So it's
Yeah,
not
yeah.
How about an
Yeah.
on-location podcast?
I saw it I was reading through the Chronicle one day and saw that there was some special event there that they were doing with some world expert that comes and does this singing bowls. Have you been?
I'm not.
No, you would love
Oh,
it.
Yeah, no, it's great.
Yeah, you would really love it. We all need to go down there. So anyway, that's what I do. But I used to do hot yoga, Bikram. I used to do it 6 days, sometimes
I can't
7
do
days
anything
a
hot.
week.
Ugh.
And I was in love with it. And I was like this rigid yoga person. And one day I was like, I am so hot, I'm literally burned out. And I quit doing it for about 2 years.
No.
And
Yeah.
I really want to get back into yoga because I miss it.
Oh, you're going to love it.
And so do my muscles and my hips. And stretching.
things.
And all those things.
Right.
How old are your girls?
13 and 15.
Tell us about the kids. Are they very
mean,
different?
They have 2 different personalities, and they're a lot of fun.
Yeah.
Yeah.
Growing like weeds, right?
I bet. Yeah.
So,
Absolutely.
13-year-old and 15-year-old.
That's something. I mean, to have teenagers and be a busy physician, and I don't know how you do
Yeah.
it. I got 2 dogs, and it's still
Right.
a lot.
One day at a time.
So what we call this is understanding the human condition. How do you balance having 2 daughters, a husband, a successful career,
Yeah.
and this life that you have, and your own human condition of staying healthy, right?
It took a long time to figure out, like I
Yeah.
told you,
Me too.
what my things were.
Yeah.
And I work really hard to make sure I'm doing all those
Yeah.
things. And you can skip one day, but if you skip like 2, you're gonna
Oh,
it gets
yeah.
iffy really quickly.
It sure does.
And so I'm a morning person also, so I'm real careful about taking that time out for myself
Yeah.
first. And
Yep.
and then
Yeah.
so my days are very crazy because 300 people have my cell phone number.
Right. Yeah. Exactly.
So-
Right.
And so I tell people it's like having 300 family members that you're responsible for their medical care,
Yeah.
right? And so
Yeah.
so it can go any which way.
Yeah.
And so I just have to be ready for that.
Yeah.
And the best way to be ready for that is to wake up ahead of everyone else.
Yeah, exactly. It is. I know. I was talking to a friend of ours. You and I share a friend, Virginia Ariaza. I always say her name incorrectly, but I was talking to her. She's an avid runner, right?
Right.
She gets up every single day, and I just envy that right now. The other Saturday, she came running by and she stopped at the house, and I was like, "What mile are you on?" And she's like, 21. I'm like, "What? Oh my gosh!"
Well, and she's
And yeah.
She's just like that. She's an endocrinologist with her 2 kids. And
That's right.
Runs every
and
day.
she manages all of it. And I was asking her, I was like, how do you do this with these kids and your husband and your house?
Yeah, yeah.
Your
I'm
mother
always in
lives
awe.
behind you, and you've got all of these things. And she's like, you got to do it.
You just do it.
You just get up and do it. And that's what I tell my patients, right? So
Yeah.
I just have to listen to myself.
True. Yeah. Give
I
advice.
know.
We need to take our own advice.
Yeah.
Right.
Exactly.
You don't worry about yesterday and how you didn't do it quite right yesterday. And you don't worry too much about tomorrow. And if you can make it, you just sort of do it right now.
Yeah, absolutely. Yeah.
So back to diabetes. What are some other symptoms that you can educate the audience as to what to look for? What are some of the signs?
I mean, the main thing with diabetes to remember, and the main thing about a lot of this stuff to remember, is that you need to go see a doctor once a year, right? Because
get your blood drawn. And
because you need to get your blood drawn. I mean, after probably 35, I mean, that needs to happen once a year, because there's just things there's questions that the doctors can ask. There's blood work. You're not going to feel diabetes right at the outset.
Yeah.
And it can be asymptomatic for a long, long time. And you want to find those things as early as possible, because when you intervene early, you protect the cells that make the insulin. And that means a longer period of time in a healthy state with just a managed disease, as opposed to like catching it when you already have complications.
Isn't there is there 4 different types of diabetes, I think, or
There's lots of different,
lots
but
of
there's
different
type
types,
1
yeah.
and type 2 is
type 1 and type 2. What's the difference?
So type 1 diabetes is an autoimmune disorder.
Yeah.
And it has 2 peaks when we see it. So this is the one that we usually call childhood diabetes, because most people are diagnosed in childhood. But there is also actually another peak in the 60s and 70s.
Yeah.
So people do get diagnosed later in adulthood also.
It's so wild. Why is that?
Why?
Yeah.
Are there 2 peaks?
Yeah. Well, I don't know. I don't either.
But there are.
Who knows? But there just are.
what are you seeing the most of in your practice right now?
Right now I see a lot of polycystic ovary syndrome, a lot of thyroid, and I do a lot of weight management and obesity. And so, and those are the pillars of prevention, right? And when you kind of work on all those things, and when you work on obesity and weight management, then the blood pressure goes away, and the diabetes goes away, and the heart disease. Like we work on all those things.
Absolutely.
And so we try really hard. I mean, one of the things that's nice about having time with people is that you get to know where they've been, and then once you know where people have been, it's easier to help them. Guide them to somewhere else.
Absolutely. Yeah, definitely. In fact, we've shared a couple of patients, I think, historically, and that's what it's all about, is helping people find what is it out there about yourself that you can dig deep in and look at. Why am I stuck, right? How did I get, either with diabetes, right? How do I get out of this syndrome? How do I eat better? How do I exercise better? And the key really is working with a multidisciplinary team of people, I think, right?
It helps.
And it seems like that's what you guys do in your practice, is you have different specialists that you guys will utilize to work with the families with whom you work, which is amazing.
Right.
Yeah, that's so cool.
Because
Oh, go ahead.
I mean, you just want to build relationships, but you also you want to give people. I try to tell people you always want to be better 3 months from now than you are now, right?
Exactly. Yeah. Absolutely.
At least to manage it, because you got to keep your headspace correct to manage.
And that's hard.
Yeah, in today's day.
No matter
day and
who you
age.
are, it's hard. It's difficult. Yeah.
Are most of your patients word of mouth then? Just referrals?
Most of our patients are word of mouth.
Yeah.
Yeah.
Gotcha.
I mean, we've been in our location right now since 2012, so we've been there for a while, and we've all been in the Houston, Texas Medical Center system for 20 plus years. So it's a lot of word of mouth.
Yeah. And you're in right there on the corner on Kirby, that great building. I love that
I love
building.
that building.
Yeah.
I
It's
know.
a great old building.
It's got to feel good to go to work every day in that building.
We have good views.
Tell people how to reach your practice if they want to reach it.
So the best way to reach us is to call. It's 832-504-9889, or it's riveroaksdoctorsgroup.com.
Very cool.
So easy.
Robin, how do people get a hold of J Flowers Health Institute.
Go to jflowershealth.com. And
Perfect.
actually, when you go to jflowershealth.com, if you'd like to see some of our other podcasts, if you go to the tab that says Meet Our Team, underneath that it says Our Podcasts. All 34 of our podcasts are on there.
Oh, very cool.
So you don't have to miss an episode.
Yep.
That's awesome.
Nice.
All
Or they
right.
can go to iTunes or...
They could. There's
Yeah.
like 6 podcast platforms
Yeah.
and YouTube as well for the
Yeah.
video version.
That's great. Cool.
All right. Thank
All
you,
right.
everyone.
Thank you, Dr. Davis.
Thanks.
Yeah.